Janet, and this is a video to chronicle my journey with jaw surgery. So today is July 1st, 2016, and a couple months ago, specifically April, I started having severe facial pain, and it migrated into bad headaches. Ended up in the ER a couple of times, throwing up, bad face pain, bad headaches, and the ER doctors insisted I had migraines and then I needed to go see my neurologist. After a couple weeks, couple doctor's visits, several different tests, a neurologist insisted that I did not have the migraines that everybody else was insisting I had. He referred me to an oral facial pain specialist, Dr. Dennis, here in Jacksonville, and she was amazing. Did several tests of her own, both the initial day that I saw her and also sent me for an MRI. And when we had the results of the MRI, she brought me back in for a detailed study of the MRI. My mom and I spent about 3 hours with her dissecting every bit of the MRI and found that my jaw decided to stop growing at probably the age of 3 or 5, or between the ages of 3 and 5. Specifically, the disc in the jaw space between my jawbone and my skull have displaced or dislocated, and they're stuck in the cheek of, or the muscle area of my jaw. They're cutting off the blood supply and causing a great deal of pain. It's apparently been this way for many, many years, like I said, since I was a child. We're guessing that possibly this happened when I had my tonsils removed, and just the sheer force of them opening my jaw and putting the breathing tube down my jaw or down my mouth when I was a child possibly forced the disc to dislocate. My jawbone, the bottom part of my jawbone, is around the size of a 5-year-old, so it decided to stop growing when I was very young. And the muscles all along the side of my face that are holding my jaw have just been, over time, wearing thin and growing weak and tired. In March and April, I was doing a lot of traveling, so I was wearing my body down to begin with. And ever since then, like I said, April 15th was the key date that it started. The pain, the stabbing all throughout my jaw started and hasn't stopped. I've since had a lot of swelling all along my jaw area, into my chin and into my throat. It's horrible. The pain is undescribable, and unfortunately nothing touches it. No amount of high-dose narcotics nor just regular Tylenol will actually get it. It's very uncomfortable. Dr. Dennis was amazing in explaining what was going on, and she also basically told us that we have 3 choices. Leave it as is and do nothing. Go on to palliative care, which is basically taking medicine to try to ease the pain, or actually surgical care and removing the disc and allowing that space to heal. So obviously, if I do nothing, I'm going to continue in pain. If I do palliative care, that's just putting a Band-Aid on it. I'm not about a Band-Aid. I've got to get this fixed. If I do nothing, like I said, it is causing the blood flow to be limited, and eventually it'll be a necrosis of the jawbone. I already have a little bit of bone loss in the left part of my jaw, so it is very real and scary for me. So she referred me to a doctor, Dr. Piper. He's in St. Petersburg, Florida, and we have an appointment scheduled in August. Like I said, today is July. We had an appointment scheduled in August to go see him. That was the earliest time he had available, but by the grace of God, I got a call today, and he has an appointment available for me on July 5th. So Monday, July 4th, we're going to pack our bags and load the car up and head down to St. Petersburg. My parents have graciously agreed to go with us because this is going to be quite an ordeal. And basically Dr. Piper's going to retest everything as if no doctor's ever seen me, and start his research and studies on me from step one. So I look forward to possibly seeing if this is the right thing. I'm asking and praying for peace throughout this whole process, and we'll just see where it goes. The pain is getting worse day by day. Talking, unfortunately, is a big deal for me, and I just want and hope for the best to be able to get this taken care of and on the road to recovery. So I appreciate all your prayers and checking in on me, and I'll continue this monitoring of this process through the video journal and also through the type journal that we're going to keep up with. As I did my research, I found that there was not much information online about this, and so I hope that my journey will help somebody else as we go forward. So thanks for watching. Talk to you soon.